Hello and welcome to our webinar, Policy Recommendations for Schools Serving Students with Brain Injury. I'm Maria Crowley, and I'm with the National Association of State Head Injury Administrators as the Director of Professional Development. I'm going to be your webinar moderator and organizer for today's webinar. Welcome to the 2021 webinar series. This particular webinar, we are happy to say and proud to partner with the National Collaborative on Children's Brain Injury. NASHIA is a nonprofit organization created to assist state government in promoting partnerships and building systems to meet the needs of individuals with brain injuries and their families. And in case you need it, GoToWebinar user guide is available for download from the NASHIA website or here. All the materials for today's presentation are going to be available in the email announcement that you used to register, and they'll also be located on NASHIA's professional development webpage. General certificates of attendance are available for today's event. They will also be located on our website and available for you to download once you've completed your evaluations. Today's webinar is going to focus on policy recommendations for students with brain injury from our partner, NCCBI, and they'll be highlighting implications that exist within the Individuals with Disabilities Education Act, which is IDEA, and will present considerations for your state in meeting the needs of students who've sustained a brain injury. I would now love to welcome our two presenters that are going to be talking with you today. Heather Hotchkiss and Melissa McCart. Heather is the principal brain injury specialist at the Colorado Department of Education, and she provides consultant training on acquired brain injury, fetal alcohol spectrum disorder, and also coordinates the BrainSTEPS Colorado Program. She brings over 30 years of leadership experience in school mental health, special education services, and brain injury. Heather's involved nationally and is past president of NASHIA and is also a member of NCCBI. Dr. Melissa McCart received her doctorate in educational methodology, policy, and leadership, and got her MS in behavioral disabilities and her administrator's licenses from the University of Oregon, where she now works. She's worked extensively with at-risk children and families as a behavior specialist and as a special education teacher. Prior to coming to CBERT, Melissa spent 7 years as a school administrator for a pre-K to 8th grade school. She's currently the project director for the Oregon TBI team and works on various other projects there. Her work combines her educational experiences with her passion for helping children and families. We are delighted for both of you to be here, and welcome.
Thanks, Maria. We are excited to be here as well. And like Maria said, we have at NCCBI, which is the National Collaborative on Children's Brain Injury, or we call it NCCBI, so you'll hear me referring to it as such, have created this document to really help school systems dive in, understand, and really carve out specific activities to hold up and serve well the students who have sustained a brain injury and their families. So what spurred us on in this endeavor is the CDC, or Centers for Disease Control and Prevention, released a report to Congress, and that was entitled The Management of Traumatic Brain Injury in Children. And this document details the impact that a TBI can have on children and their families, and it also lays out a myriad of opportunities for action, and many of which are systems or policy driven kinds of actions or activities that school systems can do and put in place. So we wanted to really kind of break these actions down and provide some additional information and some resources and tools so that school systems can really do this and do this thoughtfully and truly making systems change. So let's jump in. So IDEA, obviously IDEA has had TBI for many years in their parameters and in their categories. And IDEA stands for the Individuals with Disabilities Education Act. So it's special education. And
Heather, can I jump in and just ask you to share your slides?
I am sorry, I thought I had them up here.
That's all right.
Let me go back. Now are you seeing them?
Yes, thank you.
Unshare and share again. So, okay, sorry about that. So this is the CDC call to action, the report to Congress on the management of traumatic brain injury and the opportunities for action. And so when we get into IDEA, the Individuals with Disabilities Education Act, and truly kind of drilling down into these different areas within IDEA to understand where the implications, specific implications for students who have sustained a brain injury are and how to really lift those up and pay attention to those. It's throughout all of schooling, right? So from Part C, which is early childhood, through Part B and into young adulthood. And Part B is school-aged, so to speak. So when we think about children with TBI, there's implications kind of throughout that whole process. So a big reason why that this needs to be paid attention to is because we're not doing a great job. Frankly, we are, you know, we know that research shows that children who have sustained a brain injury face more obstacles than their typically developing peers or neurotypical peers. They have reduced functioning levels. Their health and learning issues are varied and can be very extensive. And overall, they typically have lower life satisfaction. So, and lower participation levels across social and employment and all kinds of areas of life. So we also know that when a brain injury is sustained during our childhood, while the brain is actively developing, it's different. It's a different game, so to speak, than when you are an adult and you've had all of these years of foundation laying to kind of fall back on, so to speak, and then, you know, have some compensatory strategies to really help you deal with the adult kinds of life things. When you're a child and when your brain is actively in development, it's different. It can change all of the trajectory from that point forward in that development. And so things look different and are different. And it's a chronic health condition, we know. So it doesn't go away. Brain injury is truly a lifelong thing, and it doesn't go away. It just needs change over time. And so we have to, as educators, know enough about brain injury to really understand what those changing needs at various points in time are, and how to frame our services to best meet those needs. We do also know that we are under identifying kids who have sustained a brain injury who need long-term supports. So in a study, when we looked at the data, we know that only about 32% are being served under IDEA TBI category. So there's many different reasons for that, and I'll kind of be going into some of those in future slides, but we know that we're not identifying kids, especially within that TBI category. So again, we'll go a little bit deeper into that in a little bit. So the definition that IDEA has for TBI is this: it adversely affects a child's educational performance, and there are impairments in one or more of these areas. These areas are all about the brain, right? It is about the brain, and the brain is a complex organ, we know. And we learn more and more about the brain, you know, every other week, it seems, with our research efforts around the world. So it's important that the school team understands how a student is functioning and has the tools at their fingertips to really go deep in this understanding and get a level of functioning across these various areas: perceptual, sensory, motor, attention, behavior, all of these big, broad areas, to know how to not only go through the eligibility process and determination process for an IEP, but also, which is an individualized education program, but also to be able to really frame services and supports in a way that get at better outcomes for kids. So some of the recommendations for just understanding this is that under-identification, is knowing that we are under-identifying. There are many different reasons for that. Many times we just aren't even asking the question. So our screening efforts could be completely revamped in my mind. So we know that brain injury can happen at any time during the year, and at any year during a school-aged child's educational experience, right? Or before school starts. And we don't sometimes have these questions in our developmental histories or child medical forms that we put in front of parents to gain information about their child. And even year to year, we miss an opportunity a lot of times of just asking the question, what happened over the summer? What happened, over winter break or whatever, to understand. And those things can be built in pretty easily into those regular kind of registration processes, as well as our developmental information gathering form opportunities. It can also be built into some of those areas where, if in fact we do see learning issues crop up, like within a response to intervention or multi-tiered systems of supports type of process, we need to ask the question at that point too, if there has been any type of brain injury. We know that if parents do seek out medical attention after a brain injury, which is a big if, because not all parents do, we don't even have that data, because if they go to their pediatrician, that data is not collected. The only data that we look at as far as prevalence data goes for brain injury is either emergency department visits with those certain brain injury codes, or overnight stay or in the hospital, so hospitalization days with those specific brain injury codes. So we know that even the data that we are seeing and comparing prevalence rates to identification rates in special education are low. So even that 32% under identification could be off somewhat as far as actual brain injury events. Understanding that states may differ across their definitions. So IDEA sets the floor, so to speak. So IDEA says you must do X, Y, and Z, and that's that definition about all of those cognitive kind of processing areas. States can go above and beyond that or make it a broader definition. So looking up your specific state's definition and having a good understanding of that is also a key step in this of really making sure that people understand in their state what that definition covers, as well as are we asking the questions about traumatic versus non-traumatic. We know that all types of brain injury can respond to similar interventions. So whether it's a traumatic brain injury, external force, or non-traumatic brain injury, an internal event like lack of oxygen, lack of blood flow, etc., some of those similar interventions should be applied across those groups. So looking at your state definition, understanding your system of identification and how those supports are being offered and services are being provided is a really great way to kind of start wrapping your arms around your state's policies and practices that can help students and their families. So evaluation, obviously evaluation is a huge, huge part of the IEP process or special education process. We have to have good, clean, in-depth data to be able to not only determine eligibility for special education, but then the now what, right? What do we do? What kinds of needs exist? How do we meet those unique needs? Brain injury does provide, because the brain is so complex, it usually comes with very complex needs. And so the implications for evaluation to get at those complex needs and really be able to drill down and understand a student and how they're functioning across all of those different areas of cognition is key. We know that when we identify, specifically when we identify those and really drill down and understand those unique needs, we have much better potential for better outcomes. So the long-term outcomes and evidence-based interventions, all of those kinds of aspects should be part of that evaluation process. Also, we know that brain injury teams can be trained and really do help teachers feel more prepared and knowledgeable in working with teams with TBI, students with TBI. And so there are many states that have tackled instituting brain injury teams across their state. And Oregon, Pennsylvania, and Colorado are a few of those. And we are always happy. And we represent two of those teams, Melissa and I, with Oregon and Colorado represented already on this. But we are always happy to provide other states information about how that system looks, how it was built, and supporting you guys in developing teams in your own state. So another thing to think about when we think about those unique needs is, are we identifying those? And so that whole evaluation process of tools that school personnel in the school setting can actually access and utilize in understanding a student's functioning levels is necessary, but also that training aspect and what we're calling a neuroeducational framework. When we think about a neuroeducational framework or neuroeducational evaluation, when we think about all learning issues, we do this on some level already. Multidisciplinary teams can do this across learning and behavior and things like that to truly identify how a kid's learning. But when we're talking about brain injury and the subtleties that exist within the impacts of brain injury across learning or cognition or brain processes, we have to go deeper. We have to have more discernible or ways to more discern, to get more discernible data and to really drill down and understand that a student has a skill set, but they can only access it in certain types of environments or certain types of ways. And so it can look different across environments as far as accessing that specific skill set or that brain process. So a neuroeducational framework and training around that is a really great way to arm teams, multidisciplinary teams, to do this and do this really well. We know that a more frequent review of a student's program may be necessary, especially for the few years after the initial injury, because rapid changes happen during recovery. And just that same notion that it is a chronic health condition, and so needs change over time and things look different. We also know that latent effects can happen during brain injury. So that can be years down the road, a new need arises, so to speak, a new cognitive demand comes to be and provides or shines a light on a gap that exists in that student as far as a skill set. So needs look different over time, and being able to really move along that continuum and do those checkpoints as often as needed to understand what that student needs along the way is key. Let's see. Also, the very notion of gathering data in an accessible, ethical manner that really honors where kids are can be a difficult process when we're talking about brain injury, and how kids are processing information and understanding what structures or supports need to even be in place to get a good picture of how that student is processing information may look different across with brain injury than when we're looking at other disability categories. And also regularly evaluating the kind of outside or the myriad of needs that can exist with brain injury, health needs being one of them, or absenteeism. It could be mental health needs. It could be physical health needs. Lots and lots of different facets that we need to be aware of that can absolutely be a part of brain injury. Educating educators about brain injury and the latent effects of brain injury and kind of some of the typical learning and behavior needs or how those kind of manifest itself is absolutely necessary. We know that those unique needs, if you've seen one brain injury, you've seen one brain injury, because every brain is different. And those needs or those impacts or the way that brain manifests needs is different, so to speak. So just that overall education, and then those really specific tools for that neuroeducational evaluation process. Partnering with our community organizations is also very beneficial. It can not only help in the education aspect of educating parents and families and educators, but also in those wraparound supports or providing those supports and services across time. So we'll talk a little bit about that in the next steps also. Independent educational evaluations, obviously part of IDEA, and parents can request an IEE or an independent educational eval. These are pretty close to the same recommendations as overall evaluation, but ensuring that the team of individuals, if it's a team, sometimes it's not even a team, it might just be one or two folks, is knowledgeable in brain injury is important. Not only to have all of those considerations as far as that neuroeducational evaluation and how those needs show up in the school setting, but also just the latent effects, all of the things previously mentioned. So the school setting is absolutely necessary. Many times we think, oh, we've got them going to a clinical psychologist and they can do all these wonderful tests and do a full neuropsych and we'll get this wonderful report, which is lots of information and great information. Some of it, however, or sometimes much of it, is not truly applicable to the school setting, or may not be applicable to the school setting, depending on that environment. So making sure that school-based observations, classroom-based observations, and people that know this kid and how they can or cannot access the learning environment, being an aspect in that evaluation, and bringing all of that information together to really get a full understanding of functioning is an important aspect for IEEs, since typically that's done by school personnel that may not be in that school where that student is. So things to think about. And I will turn it over to Melissa now.
Okay, hi, is my webcam up? No.
It is.
It is up, okay. All right, hello everybody. I'm Melissa McCart from Oregon, and I'm gonna take over where Heather left off here. We're gonna start by talking about the development review or revision of the IEP. So what we know is we need more frequent reviews as students recover, and that's because, as Heather said, there's latent emerging issues. There's rapid recovery in some cases. There is growing into a disability, achievement gaps growing, those kind of things. And so it's really important as an IEP team that we're constantly reviewing and thinking about what the needs of the student are. So just to talk a little bit about that, if you look at the bottom of the slide, you'll see increased executive function issues. So organization, planning, mental flexibility, reasoning, and decision making. Well, if you think about those things and a student that is in, say, high school, we expect them to be able to do these things, right? So as they grow in their educational career from, say, kindergarten to 12th grade, they take on more and more of the responsibility for handling these executive function issues themselves, as they should if they're typically developing. But if they're injured, what we know is typically kids have executive function issues that impact their ability to be successful in school, like organization, like planning, like mental flexibility, like reasoning and decision making. And so when a child is injured and they're on an IEP at school, we really need to be thinking about making sure that their IEP matches these deficits so they can be successful in school. Can we go next slide? Heather's controlling the slides. All right, so as I said, we need more frequent revision of the IEP and tracking of students' developmental and educational needs. And so what we want to do is really think about having IEP goals that work for that. One of my pet peeves is when I look at IEPs, I often see reading, writing, and math. Well, those are the things that we all do, you know, for kids. Often kids have reading, writing, and math, regardless of their disability. But for a student who has executive function issues, like the previous slide was talking about, those are really the root cause of the deficits in reading, writing, and math. And so really thinking about how that IEP provides specially designed instruction to match the root cause of the deficit. And then also at age 14, IDEA requires students have transition plans working towards adulthood. And so when we think about those goals that go on their transition plan, are they consistent with a student with brain injury, or are they cookie cutter, for lack of better terms, like, okay, this student's going to get a job, they're going to learn how to write a resume, those kind of things. But how does that apply to the student who has executive function issues or brain injury, those kind of things? So even with the transition plan, we need to be more consistent and do more reviews of the transition plan so they match the recovering student or the student who is growing in need. And these can be found on page 7 of the document we're referencing. In terms of the IEP team, IDEA requires an individual who can interpret the instructional implications to be part of the evaluation team. And what that means is at the school level, there's a whole team of people. There's usually the teacher, a school psychologist, maybe a speech therapist. Sometimes there's the principal on the team. But what is important for this team is that there's a person on the team who knows enough about brain injury that they can interpret the results of the assessment and then educate the rest of the team in terms of designing specially designed instruction to fit that student's needs. So some of the things that we've done in the states that have brain injury teams is we have very much focused on training team members to be at these IEP meetings or in the IEP teams to help with the evaluation. And that also ties into what Heather was talking about under identification, right? So if we have a team doing an evaluation of a student that on the team nobody has experience with it, the odds of doing a correct evaluation or assessment for an eligibility in TBI go down. So we want people on the teams that have experience with it, have knowledge about TBI, as well as knowledge of the educational processes and special education and their school system, so they can not only correctly identify a student who has brain injury, but also create plans and IEP goals that work within that system to really give the child the best opportunities and the best education. There's a lot of training opportunities out there. You could look at state brain injury programs, your community partners. One of the things we know is that many educators and many school psychs or psychologists don't get a lot of training pre-service around brain injury. And so looking to organizations that offer training would be very helpful. I know that, you know, our organization, CBERT, we offer lots of free webinars all the time on these kind of things. I know Heather in Colorado and Brenda in Pennsylvania do a lot of that as well. NASHIA has resources for it. So there's resources out there. It's just finding those resources and getting the right people to the table for those. Next slide. Okay, so this is what the recommendations are for IEP teams. Like I was talking about, locating training opportunities for school district personnel who can do the neuroeducational evaluations, interpret the results. And, you know, there's starting to be more awareness and starting to be more training available around this. We have a community of practice available that lots of our states have chipped in and put all their best resources in. It's readily available. There's webinar trainings, there's lots of trainings out there, so it's finding those. And then the other thing that is recommended is developing state brain injury programs. So states like Colorado and Pennsylvania and Oregon, we have those, and they're sponsored through in Oregon, it's through our Department of Ed. And I know in Colorado and Pennsylvania, they have sponsorships that are different. Heather can tell you more about those, but finding groups that will help develop a state brain injury program, that will help train team members, that help put people in schools that really know what they're looking for when it comes to TBI and really know how to do evaluations and provide support for the kids while they're in school. So the next slide is about child find. So if you're not a person who's familiar with IDEA law, child find is basically the first step. So what it is it requires that all school districts find and evaluate students who are suspected of having a disability. So all the kids in the whole school district, if somebody says, you know, I think something might be going on with this child, then the school has the responsibility to locate that child and do an evaluation to see if they need specially designed instruction or a different modality of delivery for instruction. So a couple issues that we have, requiring medical documentation is typically one of the barriers to making a child eligible for special education. And that comes That requirement comes from our federal definition of IDEA. Some states have changed that. Colorado and Oregon both have, in addition or as an alternative to the medical documentation, a credible history interview process in lieu of when you can't get medical documentation. So it's important to understand what your state requires for eligibility. Something that could be done about that is screening. So we like to say, ask a lot of questions. There's lots of opportunities to ask questions to find kids beyond teacher referrals or that kind of thing. So every year, kids fill out health cards when they come to school. They register for school. They have physical exam for sports. So there's lots of opportunities to put in some screening for kids. Like, for example, have you ever, over the summer, did you fall and hit your head? Were you in a car accident? Those kind of things that would trigger a deeper look to see if that child was doing okay or not. And then providing follow-up activities for further consideration or assessment. So if someone says, you know, we were in a car accident this year, then it would be, okay, well, let's refer you to the team so they can then evaluate and see if there's impact for school. I think next slide. All right, so screening and identification. So there's lots of screening tools available, and we're going to share those with you in some other slides, and they're also on the document that we're talking about here. So one of the things you want to be sure people do is that we educate staff about screening and about structured interviews and focused assessments. We want to talk about adding screening questions to childhood medical, you know, when they go to their pediatrician, like pediatrician has a question about brain injury or hitting your head or those kind of things. Putting them in developmental histories. In schools, we all do developmental histories, but often those developmental histories don't include questions specific to brain injury. History forms used in the child find process. So when a child is being evaluated for special education, we often do a records review and a developmental history. But the recommendation is making sure that on those forms that are used, there's questions about injury. The student's physical exam. So this is kids who, you know, maybe go every 2 years for sports, or the developmental milestones that the pediatricians see them for, making sure there's questions on those forms, and at every school's kindergarten registration process, because for a lot of kids, that's the first entry point into school, and we don't have a record prior to kindergarten. So if something happened where they were injured between birth and 5 or 6 years old, when they start kindergarten, we wouldn't have a record of it in the schools. And so it would be important to think about on the kindergarten registration how you might capture some of that information. And next slide. So this is the screening tools I was talking about earlier. So one of the recommendations is to adopt a TBI screening tool to be used annually. There's lots of tools available. You can see the list there. There's the Colorado BrainCheck Survey, the HELPS Brain Injury Screening Tool, the OSU TBI-ID, and Safe Child. But you could even develop your own. So these ones are ones that are out there. There's an easy, you know, if you were just trying to put it on kindergarten registration cards, you would just put a couple questions. So there's lots of ways to do this, and there are tools available. And then the last thing we're going to talk about is related services. So if you are not a person who works in special education, you might not know what related services means. In special education, when a student has an IEP, they get IEP goals in things like reading, writing, math, those kind of things. But related services can be goals or services that can be in addition to those IEP goals and the specially designed instruction. So often kids who have more moderate to severe brain injury also have physical and medical and health needs. So sometimes you might see seizures, they take medications, they might need help in eating, those kind of things. And so that would be listed as a related service on their IEP. So it would be important to involve the school nurse in that. They often have protocols for all of those things. In addition to medical, physical, and health needs, there's also communication that might be a related service. That could be something like, I'm trying to think, like communication devices, things like iPads, processes for communicating with families, those kind of things. Other related services you might see are things like assistive technology, especially now with remote learning. But so there'd be related services about maybe how to use the assistive technology or which assistive technology is assigned to that child. And then related services about remote learning might be, different access points for remote learning, different hours for remote learning, meeting with teachers separately from the whole class, those kind of things. So those would be listed on students' IEPs as extra above and beyond specially designed instruction. So the next slide talks about the related service recommendations that we have. So with related service, it's important to adopt a process for communicating with parents and healthcare providers, especially with brain injury. And I have found doing the work that I do that this is one of our number one things we can put in place to help kids. Often when a child is injured, they didn't have any of the, they were typically developing prior. And so parents maybe don't have a background in having to communicate with the school constantly. All of a sudden we have healthcare providers involved, and there's a lot of players. And so, and they all have important information. And so coming up with a process for making sure that that child's team is communicating well is very important. And it's also important to utilize individualized healthcare plans in conjunction with the IEPs. And that might be something like we were talking about when children have seizures or they have medical needs, like how those two things are merged together to provide the best services possible for students. All right. And then we're on to our next step slide, and I think Heather is going to join us on that one. Are you still muted?
I'm mute,
There,
yes.
There you are.
So thanks, Melissa. Yeah, you had mentioned the different structures that different states have, and it feeds right into this next steps, kind of that locating support in your state. So I will circle back to that a little bit for Colorado and Pennsylvania anyway, and how important our partners are in providing this in the Department of Education. So I definitely sit at the Department of Education in our special ed unit or exceptional student services unit, and we partially fund our BrainSTEPS teams, which is that consulting team model in our state. We also get support and funding from our MindSource, which is our state level brain injury program. So it's that first bullet on the list right here on this slide, to help support that program. And so we partner across the state to do that. We at the Department of Education roll out all of the training and all of the coaching and support. And I co-coordinate that with my colleague who sits over in the Health and Wellness unit at the Department of Education, which is a really nice model. Not many state departments have one brain injury specialist, let alone two. I realize that we are a unique kind of makeup in Colorado for sure. But in order to really cover that full continuum of from mild to severe, including special education, we can partner well across the special education and health and wellness units to really get that full continuum covered, from mild or gen ed kinds of concussion kinds of issues to full-on IEPs and everything in between. But I think so thinking about, and the BrainSTEPS program in Pennsylvania is a partnership between their Department of Health and the Department of Education, and then also that community-based brain injury alliance or association can also be very helpful, and depending how those function in states, because they vary as far as how they function and the populations that they work with. We have an educational liaison that sits in our Brain Injury Alliance here in Colorado, so it's a really nice partnership, and we work really closely with referrals back and forth and supports for families who have kids who have sustained a brain injury. So it's a really nice partnership. So when we're thinking about, when you're thinking about your state and kind of lifting up some of these aspects, who's your champion, or who can you build as your champion is really a question. Many of these bullets, there's some version in many, if not all states. And so thinking about your relationships and thinking about their already set goals and how those work into those goals is an important consideration.
In Oregon, we are completely supported by our Department of Ed and have been for over 30 years, actually. And so the funding comes for the Oregon TBI teams through the Department of Ed, but also what makes it so successful is we're able to partner with a lot of these kind of programs. And when I've had other people ask me, what would you do in a specific state to make this happen? I'll mirror what Heather said. It's like, find the group that's willing to partner and champion and then collaborate with as many groups as you can in partnership to get the best outcomes and get things rolling.
Yeah. Thinking about just brain injury in general, it doesn't live in one system, right? It's across many systems, disability councils, protection and advocacy programs and organizations. All of those systems can be really instrumental in partnering to not only lift that aspect up as far as their system goes and the attention on brain injury in their system, but also partner to bring it across many systems to work together in better meeting those needs.
Mm-hmm. Some of the groups that I realized we left off this slide are hospital groups. We have a lot of partners and partnerships with hospital groups, and establishing that relationship with the schools in particular really makes a big difference. And often the hospital folks are pretty well connected within the state, and they have other agency connections they can pull in as well. And so we find it vital to partner with our hospitals.
Absolutely. Our Children's Hospital and Craig Hospital here in Colorado directly refer kids to our BrainSTEPS team, so they can get all of those releases and work with parents side by side in making that a smooth transition, either back to school if that's the case, or remaining in a hospital setting if that needs to be, and working together to best provide education for that student. So lots of partnerships and lots of activities within those partnerships can really, really be helpful. So when we think about the resources, and Melissa mentioned the document and how we have cross-referenced these slides with specific page numbers throughout the document so that people can kind of use the webinar and the document hand in hand and go back and forth. We've got a ton of information in this document and more resources and actual links to those resources. So feel free to pull that up. This is the link. It is on the CBERT, or the Center for Brain Injury Research and Training website, and at the top of that list. And then also we've got on here NASHIA, of course, and the technical assistance and policy development that NASHIA provides to the government systems, but also community agencies and the system in general is invaluable for this work as well. The brain injury team models, there's more information at these links of how we have set up our teams and kind of the roles that they play within each state. And I think I mentioned BrainSTEPS, but maybe not. So BrainSTEPS is the model that both Pennsylvania and Colorado use. And Pennsylvania has had BrainSTEPS now for, I think, 11 going on 12 years now in place. And Colorado had brain injury teams, or brain injury resource teams, we called them, and then formally moved over to the BrainSTEPS model in 2016. So I've had a couple of different looks to the way our teams have functioned in our state. So, and then Oregon, obviously Melissa's the main person for that connect. So neuroeducational, yeah, go ahead.
I was gonna say, I'm noticing the link for CBIRT is missing the B. It should be cbirt.org. So if you click on that link and it doesn't work, just add a B between the C and the I.
Yep, that is.
It happens.
Catch. The neuroeducational evaluation models links listed here are on Colorado's. There are the first two links, and it's a free, useful model right now. It's useful, but obviously the training aspects would want to go hand in hand with that to get people up to speed on how best to use that model. But it is a user-friendly model, so feel free to go there and learn more about it, or contact me for more information. And then the North Carolina one is that last bullet there, and they have a full-on program that trains school psychologists specifically in this process, ensuring that brain injury knowledge and brain injury assessment data is accessible for students who have sustained a brain injury in schools. So, other aspects to add there, Melissa?
I would say under Oregon, we have the returntoschool.org, which is our new school-specific website, and it has lots of free training opportunities available that anybody can use in any state. It's got a general page and then a Oregon-specific page, so feel free to utilize anything on both the CBIRT and the Return to School page. We put it out there as open source. Anybody can use it. And I think that's the same with everything listed here.
Yep, definitely. So any additional information or training opportunities that you'd like to ask about, this is, you can absolutely reach out to NCCBI. There's 3 of us listed here, Melissa, myself, and Drew. And this is our direct email addresses, so feel free to reach out to that and to us for any reason or for more information, and we're happy to support your state's process. We'd like to thank NASHIA for hosting our webinar today, and we thank you for supporting children with brain injuries and their families, and we appreciate what you guys do for kids and their families each and every day. So thanks.
Thank you.
Thank you both so much, and thanks to NCCBI as well. You can see it's readily apparent that these 2 women are dedicated experts in this field, and we're just very excited to see the recommendations, and we appreciate all your passion and your efforts and energy on it, and for sharing that with us today. We really appreciate it.
Thank you, Maria.
If you enjoyed today's event, stay tuned for the rest of our 2021 webinar series. Look at our calendar on our website, or sign up for announcements about some of our other training events. as well as some of our products, podcasts, and leading practices academies. We also offer training packages and can customize tools for your organization and state. We want to thank you so much for viewing our webinar today. Please contact us if you want to receive notice of future events or other resources. And our materials are available online, and we would certainly love to have you as a member. Please visit us at www.nashia.org and have a great day.